Wear personal protective equipment. Provide client privacy. Regulate the temperature 25 to 28 degrees Celsius to prevent maternal and neonatal hypothermia. Assemble the equipment needed in immediate newborn care. Sterile gloves, sterile gauze pad, cord clamp, forceps and Mayo scissors, sterile cloth, kidney basin, tape measure, eye ointment, vitamin K, tuberculin syringe, and thermometer.
Hello, I am Hannah Gando, your nurse for today. For verification purposes, could you please state your full name and date of birth?
I am Mrs. Madeline John, born on November 15, 1997.
Mrs. John, I will be assisting you before, during, and after the delivery of your baby.
And perform immediate newborn care to your baby.
Mrs. John, I will now expose your perineal area, okay? Crowning is present. I will now put on my gloves and assist the normal spontaneous delivery of the baby. Mrs. John, I can see now the top of the head of your baby. Please do a deep breathing and push, okay? 1, 2, 3, push! 1, 2, 3, push! 1, 2, 3, push! I will assist the delivery of the baby's head using Ridgen's maneuver. After the baby's head is delivered, I will wipe the secretions from the baby's mouth and nose with a sterile gauze to clear the baby's air passages to facilitate breathing. First, I will wipe the baby's mouth with a sterile gauze. Then discard. Then using a new sterile gauze, wipe the baby's nose. Then discard. After wiping the baby's mouth and nose, I will assist in delivering the rest of the baby's body. Baby girl out, 12:55 a.m., December 1, 2021. Congratulations, Mrs. John. After the delivery of the baby, I will place the baby at or below the vaginal introitus for 3 minutes so that the fetoplacental circulation will not be immediately occluded by clamping the cord. A minute after the delivery of the baby, I will assess the baby's adaptation in extrauterine life by getting the Apgar score. Assess baby's color, pulse, grimace, activity, and respiration. Baby's body and extremities pink.
Baby's pulse is 97 beats per minute.
Baby executes a strong cry when stimulated by touching the soles of the foot. And baby flexes arms and legs to resist extension. Apgar score is 9. Baby adapted well in extrauterine life. Then, I will place the baby on mother's abdomen in a prone position with the head lying on one side. sterile cloth, I will immediately and thoroughly dry the baby. I will remove the blood and spread the vernix caseosa on newborn skin to facilitate extrauterine adaptation. Then, I will now clamp and cut the cord. First, I will feel for the cord pulsations. When it stops, I will clamp the cord with a plastic umbilical clamp 1 inch from the base. And clamp it with a forceps 5 inches from the base. Then, cut 1 centimeter from the cord clamp. After cutting the cord, I will put an identification tag on baby's leg or as defined by institution's policy. I will tell the mother to maintain skin-to-skin contact with her baby for 30 minutes to 1 hour for latching. Mrs. John, please maintain skin-to-skin contact with your baby and look out for the signs for latching and make your breast ready for breastfeeding. After the skin-to-skin contact of mother and baby, I will measure the baby's weight. I will place the baby naked on the weighing scale adjusted to 0 and get her weight in kilograms. Baby girl weighs 2.9 kilograms. I will place the baby on a clean and dry blanket under a drop light to bring comfort while getting the anthropometric measurements. First, I will measure the head circumference and the most prominent part of the head at the level of the baby's eyebrow. Head circumference is 33 centimeters or 13 inches. Second, I will measure the chest circumference at the level of the baby's nipples. Chest circumference is 30 centimeters or 12 inches. Third, I will measure the abdominal circumference above the baby's umbilicus to determine the size of the abdominal viscera. The abdominal circumference is 31 centimeters or 12.5 inches. Then, baby's height or recumbent length will be measured by 2 persons to ensure correct positioning of the baby. I will place the baby supine on the length board with a soft thin cloth. The assistant holds the head in midline with the crown of head against headboard, ensuring that the baby's head is positioned in Frankfurt vertical plane. And I will ensure that the baby's body is extended well on the length board and moves the footboard against the heels of both feet. with toes pointing upwards. Measure the height twice in nearest millimeter. Then average the values, then record. Baby's height is 50 centimeters. Then, I will record the baby's anthropometric measurements. Then, I will take the baby's rectal temperature. Baby's rectal temperature is 37.5 degrees Celsius. Based on the appearance of baby's anus, there is no imperforate anus. I will now put on baby's diaper and dress to keep her warm. Then, I will now apply Creed's prophylaxis or ophthalmic ointment to the baby's eyes from inner canthus outwards to prevent eye infections that can be caused by bacteria in the birth canal. After 1 minute, I will remove the excess ointment to the eye using sterile gauze. Then discard, then use another one to wipe the other eye. Then, I will administer 0.1 ml of vitamin K intramuscularly to turn baby's left thigh to help blood clotting and prevent bleeding, because babies are born with low levels of vitamin K, and it takes few weeks for the baby's liver to produce enough vitamin K to stop bleeding. I will wrap the baby comfortably and put her to mother's side. Mrs. John, here's your baby girl. The immediate newborn care is done, and your baby tolerated the delivery well and adapted to extrauterine life. After the immediate newborn care, I will record all data on baby's chart and delivery record book. Baby girl out, 12:55 a.m., December 1, 2021. Apgar score of 9. Baby able to adapt to extrauterine life after delivery. Weight 2.9 kilograms. Height 50 centimeters. HC 33 centimeters or 13 inches. CC 30 centimeters or 12 inches. AC 31 centimeters or 12.5 inches. Rectal temperature 37.5 degrees Celsius. Creed's prophylaxis administered to both eyes. Vitamin K administered intramuscularly on left thigh. Nurse's signature.